Question 161. A nurse is talking with a client who reports constipation. When a nurse discusses dietary changes that can help prevent constipation, which of the following foods should the nurse recommend? A. Macaroni and cheese. B. Fresh fruit and whole wheat toast. C. Rice pudding and rice bananas. D. Roast chicken and white rice. Answer B. Explanation. A high fiber diet promotes normal bowel elimination. The choice of fruit and toast is the highest fiber option. Macaroni and cheese is a low residue option that could actually worsen constipation. Rice pudding and rice bananas are low residue options that could actually worsen constipation. Roast chicken and white rice are low residue options that could actually worsen constipation. Question 162. A nurse is caring for a client who has diarrhea for the past 4 days. When assessing a client, the nurse should expect which of the following findings. Select all that apply. A. Bradycardia. B. Hypertension. C. Fever. D. Poor skin to gore. E. Peripheral edema. Answer B, C, and D. Explanation. Prolonged diarrhea leads to dehydration, which causes a decrease in blood pressure. Prolonged diarrhea leads to dehydration, which causes fever. Prolonged diarrhea is more likely to cause tachycardia than bradycardia. Peripheral edema results from a fluid overload. Prolonged diarrhea is more likely to cause a fluid deficit. Question 163. A nurse is preparing to administer a cleansing enema to an adult client in preparation for a diagnostics procedure. Which of the following are appropriate steps for the nurse to take? Select all that apply. A. Warm the enema solution prior to installation. B. Position the client on the left side with the right leg flexed forward. C. Lubricate the rectal tube or nozzle. D. Slowly insert the rectal tube about 2 inches. E. Hang the enema container 24 inches above the client's anus. Answer A, B, and C. Explanation. The nurse should warm the enema solution because cold fluid can cause abdominal cramping and hot fluid can injure the intestinal mucosa. Option B allows a downward flow of solution by gravity along the natural anatomical curve of the sigmoid colon. Lubrication prevents trauma or irritation to the rectal mucosa. Option D is an appropriate length of insertion for a child. For an adult client, the nurse should insert a tube 3 to 4 inches. The height of the fluid container affects the speed of installation. The maximum recommended height is 163 inches. Hanging the container higher than that could cause rapid installation and possibly painful distension of the colon. Question 164. While a nurse is administering a cleansing enema, the client reports abdominal cramping. Which of the following is the appropriate intervention? A. Have the client hold his breath briefly. B. Discontinue the fluid installation. C. Remind the client that cramping is common at this time. D. Lower the enema fluid container. Answer D. Explanation. To relieve the client's discomfort, the nurse should slow the rate of installation by reducing the height of the enema solution container. Taking slow, deep breaths is more therapeutic for easing discomfort than holding the breath. The nurse should stop the installation if the client's abdomen becomes rigid and distended, or if the nurse notes bleeding from the rectum. Option C is not therapeutic as it implies that the client must tolerate the discomfort and that the nurse cannot or will not do anything to ease it. Question 165. The client with chronic pulmonary disease has a blues tinge around the lips. The nurse charts which term to most accurately describe the client's condition. A. Hypoxia. B. Hypoxemia. C. Dyspnea. D. Cyanosis. Answer D. Explanation. A blue stain to mucous membranes is called cyanosis. This is most accurate because it is what the nurse observes. The nurse can only observe signs, symptoms of hypoxia. More information is needed to validate this conclusion. Hypoxemia requires blood oxygenation saturation data to be confirmed, and dyspnea is difficulty breathing. Question 166. To prevent post-operative complications, Nurse Kim assists the client with coughing and deep breathing exercises. This is best accomplished by implementing which the following: A. Coughing exercises 1 hour before meals and deep breathing 1 hour after meals. B. Forceful coughing as many times as tolerated. C. Half coughing every 2 hours or as needed. D. Diaphragmatic and pursed lip breathing 5 to 10 times, 4 times a day. Answer C. Explanation. Half coughing helps keep the airways open and secretions mobilized. Half coughing is an alternative for clients who are unable to perform a normal forceful cough. Deep breathing and coughing should be performed at the same time. Only at meal times is not sufficient. Extended forceful coughing fatigues the client, especially post-operatively. Diaphragmatic and pursed lip breathing are techniques used for clients with obstructive airway disease. Question 167. Nurse Trixie is preparing to perform tracheostomy care. Prior to beginning the procedure, the nurse performs which action? A. Tells the client to raise 2 fingers to indicate pain or distress. B. Changes screw tape holding the tracheostomy in place. C. Cleans the incision site. D. Checks the tightness of the ties and knot. Answer A. Explanation. Prior to starting the procedure, it is important to develop a means of communication by which the client can express pain or discomfort. The twill tape is not changed until after performing tracheostomy care. Cleaning the incision should be done after cleaning the inner cannula. Checking the tightness of the ties and knots are done after applying new twill tape. Question 168. Which action by the nurse represents proper nasopharyngeal or nasotracheal suctioning technique? A. Lubricate the suction catheter with petroleum jelly before and between insertion. B. Apply suction intermittently while inserting the suction catheter. C. Rotate the catheter while applying suction. D. Hyperoxygenate with 100% oxygen for 30 minutes before and after suctioning. Answer C. Explanation. Rotating the catheter prevents pulling the tissue into the opening on the catheter tip and the side. Suction catheters may only be lubricated with water or water-soluble lubricant, and petroleum jelly such as Vaseline has an oil base. No suction should ever be applied while the catheter is being inserted because this can traumatize tissues. The client should be hyper-oxygenated for only a few minutes before and after suctioning, and this is generally limited to clients who are intubated or have a tracheostomy. Question 169. Which client statement informs the nurse that his teaching about the proper use of an incentive spirometer was effective? A. I should breathe out as fast and as hard as possible into the device. B. I should inhale slowly and steadily to keep the pulse up. C. I should use the device 3 times a day after meals. D. The entire device should be washed thoroughly in salty water once a week. Answer B. Explanation. Proper use of an SMI requires the client to take slow, steady inhalations every 4 hours of 2. 5 to 10 reps each time. Only the mouthpiece can be successfully rinsed or wiped clean. The device should not be submerged in water. Question 170. While client with chest tubes is emulating, the connection between the tube and the water seal dislodges. Which action by nurse Flora is most appropriate? A. Assist the client to emulate back to bed. B. Reconnect the tube to the water seal. C. Assess the client's lung sounds with a stethoscope. D. Have the client cough forcefully several times. Answer B. Explanation. The tube should be reconnected to the water seal as quickly as possible. Assisting the client back to bed and assessing the client's lung are possible actions after the system is reconnected.
Thank you for watching.